Hello, I'm Alex Serbanowski, a Wollongong and Sydney clinical psychologist and life coach from Alex in Psychology and author of Fulfilling Happiness. What I'm going to do now is discuss a scientifically validated test for depression, anxiety and stress. Unlike other depression tests, this also measures anxiety and stress and is freely available online. In fact, this is the test that many of the doctors I know use and what I also personally use in treating my clients who may be suffering from depression, anxiety or elevated stress. The test is called the Depression, Anxiety and Stress Scale, and there are two versions, one with 21 questions and the other with 42 questions. It generally takes less than 5 minutes to do and less than 5 minutes to score. It is freely available, as I said, online, and there is a link to it for registered users on my alexinpsychology.com website. Now, I prefer to use the 21 item version with my clients as it is faster. It is a very simple test and very easy to complete and score. Here's how it works. At the top of the sheet there are the instructions and they ask you how you've been feeling over the last week, but I prefer you to answer it as if you've been thinking or feeling how you see yourself over the last 2 weeks, not 1, 2 weeks. You then read each question and answer each of the questions between 0, where 0 equals it did not apply to you at all, 1 equals it applied to you some of the time, 2 equals it applied to you a good part of the time, 3 being most of the time. And then once you're finished, you look at the scoring sheet and write the letter S, A or D next to each question that it refers to. It's very self-explanatory, you'll be able to see how to do this. So as an example, question 1 you would put an S next to, question 2 you'd put an A, question 3 you'd put a D. Okay, the scoring sheet will show you how to do that. And then you add all the S numbers, all the A numbers and all the D numbers. Now if you've answered 42 questions, if you have the 42 question version, then that's your final score for each category, D, A and S. If you have the 21 question version, the DAS 21, then you need to double your scores at the end. Double your S, your A and your D score to get your final score. Once you have your final scores, you can see which categories your scores fall into. The categories are normal, mild, moderate, severe and extremely severe. If your scores are severe or extremely severe, I suggest you consider visiting your family doctor for further assessment and to discuss possible treatment options. And having a course of sessions with a clinical psychologist such as myself is one of the most common and effective drug-free ways to overcome severe to extremely severe category issues in that test. In my experience, scores that are mild to moderate generally refer to more of a dissatisfaction with life. They're not as serious and you may actually benefit more from life coaching, which is also what I provide. If you live in the Wollongong or Sydney area of Australia, you can contact Alex in Psychology on 8205 3105 during business hours. And if you need more information, visit alexinpsychology.com.